Do facilities have the jurisdiction to not allow any compassionate care or essential care giving visitations, even with guidance that have been released several months ago?
I'll start. Why? Why are you not allowing compassionate care or essential caregiving visitations? I understand people are scared and they want to keep COVID out of their buildings, but I can tell you from a long history of working in long-term care that there are other reasons why that would be perceived as why someone would want to keep a compassionate caregiver or essential caregiver out. And I don't want to go any further than that. You all know what I'm talking about. I would say that you have to very carefully, that would be like the same thing now because we have the tools. At the very beginning, it was different. We didn't have a vaccine. We didn't have testing like we do now. We didn't have a lot of our staff. Think about what we were dealing with in April and May when we didn't even have appropriate PPE for our staff to use. Now that isn't the case. There is PPE available. There's screening available. We know a whole lot more about how this is transmitted. So not allowing compassionate care or essential caregiving is sort of opening yourself up and not following the guidance and not having a really good reason for why. Is sort of opening up for the same thing that you would have had 5 years ago, where you locked your building down and said that nobody could come visit their family members. I would be careful with that, and I would go over what is posted on IDPH, what is posted regarding compassionate care, essential care, and going back to that September 17th guidance from CMS, and I would be very careful that whatever you're doing follows that.
The only other thing I would add to that is, I thought you said end of life too, and I would hope and pray that, nobody should have to die alone. So please consider those all types of situations and allowing family members for those things to come in for those things.
Exactly. And they could be, and I'm sorry, I'm going to go off just a little bit here, but we used to have family members that would come in and they would feed their family members. They would take their family members to the toilet. They would make sure that they didn't wander. They would make sure that they didn't fall. And I was always, as a staff nurse, I would breathe a sigh of relief when that person came in, because I knew that, number one, we had a well-established relationship with them. We knew they knew what they were doing because we had either gone through guidance, they'd ask questions, whatever. So we knew what they were doing. They were treated almost as volunteer staff, which is what you're looking at with essential caregiving. And we had essentially competencied them. So we knew that they knew how to do what they were sort of charged with. And they knew that if it was beyond that, they would ask for help. So there's a whole lot of practical stuff, but it can actually help provide support to that resident. And a lot of times it's critical.